Hi guys, Dr. Brotsky here. It's week 27 of your pregnancy. If you haven't checked out the other videos so far, take a minute and do that sometime. So this is the last week of your second trimester. Very exciting. We're gonna start seeing you every 2 weeks at 28 weeks. So you're almost in the last stretch, you can do it. So things you can expect right now are lots of fetal movement, like I've mentioned before, lots of regularity to that too. So some people get really busy at work and may not feel the baby move routinely. So just make sure you're taking a couple of dedicated times during your workday to stop what you're doing and try to block out some distractions and make sure your baby's moving okay. And then you can talk to your doctor about it if you're concerned or if it's not normal. Another thing you may notice as well is maybe some secretions from your breasts. And this is very common. It's not actual milk let down yet, but you can absolutely get development of those milk ducts this early in pregnancy. So don't be alarmed if you start noticing leakage at this time. You may also notice more leg cramps when you sleep. And I know this is a painful process. It's basically all that extra fluid that surrounds the muscles and the ligaments in your legs. So try to elevate your feet as much as you can and just know that it's very, very normal. As far as a doctor's standpoint at this point in pregnancy, probably you've completed your diabetes glucose testing, and so we've also been able to check and see if you're anemic at all. Your doctor may tell you you're a bit anemic and that you need to add some iron into your daily routine. So iron usually is just found over the counter at the pharmacy. It's very poorly absorbed orally though. So it's important to try to, when you take iron, to drink some orange juice or some vitamin C with it to increase the absorption, and also stay away from milk around the time of that dose. And then your doctor will likely check up on your blood count later on in pregnancy again and make sure that it's doing its job. Iron does have some side effects. It's famous for constipation and can cause your GI system to be a little upset. So just be aware of that. The other thing your doctor might take note of is what blood type you are. I know that we tested for this much earlier in pregnancy, but at 28 weeks, that's when we routinely give a shot if you have a negative blood type. So that's something that your doctor will start looking at to see if you need that around the beginning of the third trimester. Things for you to do right now are just to make sure your schedule is going to allow you to come and see your doctor every 2 weeks. You may notice that you have to talk about that with your supervisor at work or something more often, so that they're comfortable and can be aware of that. Totally normal. You can start thinking about developing a birth plan if you want to have a birth plan. Not every patient feels the need to do that. So if you do, you might start working on some of those things so that you have plenty of time to review it with your doctor in the office. The other thing I would think about doing right now is just to look in your records if you can and find out when your last Tdap vaccine is. Tdap is tetanus, diphtheria, and acellular pertussis. So this is the whooping cough vaccine that's really going to help protect infants from whooping cough. And so we are interested to know when your last Tdap was, because if it wasn't during this pregnancy or prior, then we want you to be vaccinated at the beginning of the third trimester, along with anyone else in the house that has not been vaccinated. That's it for week 27. Thank you so much for checking out my video. Look at the other ones on the same channel, and you can find me at drbrotsky.com.